So in the first stage of labor,
Got it.
why they got to do this? Okay. It's called the latent stage. So you're going to be in this stage for about 6 to 8 hours. This is just a guess. People are in it all over the place, but this is just so you can kind of have an idea. You're anywhere from 0 to 3 centimeters dilated. You probably were already before you even went into labor. Okay. So contractions are mild to moderate. They're kind of irregular. They're 5 to 30 minutes apart. They're lasting 30 to 45 seconds. You're still happy at this point. Okay. And probably at home. Okay. As far as the descent, if you have never had a baby before, you're probably around 0. Okay. If you are multi-parous, that baby's probably already starting to, the baby will probably get -2 to -2 to 0. Okay.
Got it.
Okay.
I'm cool. Why would it if first baby? So like, okay, why if it's a multiple baby? I would think that would be lower.
They're usually bigger, right? The more babies that you have, your babies typically get bigger over time.
Okay.
So they may not do, but that's a good point. Once they actually get into labor, those babies come faster once you're actually like in it. Okay. But also the uterus is stretched out at that point. So sometimes like the more babies that you have, they're just pretty comfortable in there and they'll take longer to come out as far as weeks. So you may go further and further. That's a good question. Okay. You may have a like brown discharge or mucus plug, like just very small amount. You're not like losing a ton unless your water already broke. Right. And then obviously that's a lot at first. You're awake, you're alert, you're excited, kind of nervous, but you're like, this is fine. If this is what people were talking about, everything's good. Okay. So if she is in the hospital during this point, which a lot of times she won't be, we'll tell her like, hey, go home and come back later. But if they do happen to admit her, like if you are in a fancy hospital where they care about you, then we'll do vitals like Q 30 to 60 minutes. We'll look at the fetal heart rate every 30 to 60 minutes. So basically you're going to check on them like every hour or two. Okay. Temperature Q4, we are looking at the rupture of membranes or looking to see if they have ruptured membranes every 2 hours, but she'll probably tell you. Okay. Periodic vaginal exams, we're just kind of checking to see on the progress. We want her to get up and pee every 2 hours, okay, because full bladder will also impede your labor, okay, which is why we put in a Foley for all the other moms who are laying down, okay. Get them up, get them moving. Make sure you start IV fluids. We're calming them down. Chamomile, lemon balm, peppermint tea. Everyone's just trying to eat. All right, we're going to monitor eyes and nose, change your position, emotional support. As soon as they come in, we start an IV. We get them on IV fluids and we draw blood. We are drawing, and we want them to pee in a cup. Obviously, we're looking for proteinuria to see if they are eclamptic. We're looking for glucose to see if they have gestational diabetes. We are looking for bacteria to see if they have a UTI. Okay. Then we're going to do, okay. We will do a CBC. And what am I looking at? Infection, but probably not because they're probably going to be elevated, right? So I need to more look at,
Is there any?
Yeah. So I want to look at their H&H. Okay. We will do an HIV test, a type and screen in case she loses a whole bunch of blood, right? And then a GBS, which is group B strep, and that's either a where do they swab or
In the
rectum. Okay. Change their linens frequently. That's what it says at the bottom. Because they're just going to be using fluid continually for the next like 12 hours. Okay. And it's gross to sit in your own liquid.
So that water doesn't have to be broken here?
Absolutely not.
Okay.
Okay. A lot of people don't break the water till way later. Or sometimes if they fail to progress, we go in and break the water.
Okay. So that really doesn't matter.
No. Okay. All right. Active. This will last about 3 to 6 hours. They're at 4 to 7 centimeters. So we're like kind of like halfway there. Okay. Contractions are starting to kick up a little bit. Everybody's getting a little more excited. Not in a good way. 40 to 70 seconds, 3 to 5 minutes apart. You're usually at +1 to +2. So baby's actually like engaged. We're down in there, right?
Yes.
Right. We may see pink or bloody discharge, scant to moderate, not that big, unless again, if their water breaks, obviously. This is the part where things start to hurt. Okay. So they're going to get a little nervous. They're going to need their support person. They're going to be very tired. Do you remember what a malar flush is? We talked about this with like asthma.
It's just like the redness of the ear.
Yeah. Their face is going to turn red. We've got all this inflammation, right? We have all this blood flow, vasodilation. So that's when you may want to put like a cool rag on their head or maybe behind their neck to kind of help, cool things down a little bit. Now vitals, we're going to do Q30. We're still going to do temperature Q4 and all that. It's all pretty much the same, right? So vaginal exams here and there, assess mom and just check on her every 5 or 10 minutes. Now at this point, she can only have clear liquids or ice chips. Okay. She cannot order like a burger, right? Because she might puke. Yes. A lot of people puke during. But you do still want her to have like something, put ice on the lips, let her suck on ice chips, something like that. They've actually changed that to now where they'll let you drink during labor. But I did that and it was a big mistake. So take that with a grain of salt. Because I'm a puker. So I drank a ton of fluids because I was thirsty. And then I puked them all up. So just, whatever you want to do. Encourage voiding Q2 if they don't already have a Foley in or if you haven't gotten an epidural, which they shouldn't at this point because it's still too early. Y'all know if you put the epidural in too early, it won't last long enough. And then that's
So
bad.
when should you?
You usually do it somewhere around 7 to 8 centimeters. That way I still have enough time because you got to call the anesthesiologist. They have to come down. That all takes some time. So you can't wait too late because then what if mom progresses really quickly and then she doesn't get one? But if you start it too early, she can fail to progress. And then it can also wear off by that point. And
We can't just add more beds.
I mean, you can, but they don't want to because you want mom to actually be able to be up and moving as quickly as possible after delivery. Otherwise, she's going to be in bed for another, 12 hours. We don't want that.
So 4 to 7 is like a good spot. So like maybe
No.
order one.
7 to 8.
7 to 8.
Yeah. No, you don't want to order it until because anesthesiologists, if they do come quickly, they're not going to wait. They're going to come down, drop it, and go. So if they come down and she's too early, they're just not going to come. So you got to plan this very well. Okay. All right. Position for comfort. Okay, whatever. Sponge face with a cool cloth. Okay, and non-pharmacological pain relief. Like we're gonna calm everything down, get everybody out of the room, turn down the lights because like mom's starting to get kind of fussy. Okay. Note the time of rupture of membranes. It is very important to look at the color and the consistency. What if it was brown?
Dried up blood or like old blood? Okay.
Yes, that is called a meconium stain. Baby pooped in utero, right? Means that mom's going to need antibiotics. Okay. And if we can give maternal antibiotics during labor, baby may not need to go to NICU. They used to send all the babies to NICU and give them 2 days of IV antibiotics. And they're like, that's kind of dumb. Let's try to give them to mom and then baby will get them while we're delivering, right? What's wrong? Oh, you look nervous. Okay. And then if it's like a thick or it has a very foul smell to it, that could be what we call chorioamnionitis. That's an infection in the amniotic fluid. Again, mom's going to need antibiotics and so will baby. Okay. So you need to look and see. It should just be clear. It looks just like water.
So rupture of membranes, is that the same thing as like your water leaking? Okay.
Yes. So the bag breaks and okay. All right, then we're going to go into transition. This is a short period of time, 20 to 40 minutes. That's why you got to plan your epidural real carefully, right? You are 8 to 10 centimeters. The contractions are strong, regular, 2 to 3 minutes, 45 to 90 seconds. Baby's down in there, +2 to +3. We about to go?
Yes.
We about to go. They probably have a lot of bloody mucus because everything's tearing and ripping and yeah, there's a lot. And so you'll usually put like a bunch of chucks, you know what the chucks are?
Yeah.
Underneath the mom and then just kind of start peeling away the layers as it keeps, because nobody likes to sit in their own junk. Like that just feels awful. You already feel gross anyway. Behavior and appearance. We're nervous. Okay. Pain, anxiety, fatigue. Some of people are panicking. I can't do this. I can't do this. Sweating. Okay. Now shaking. That is something I was not prepared for. Their legs will shake so bad. Some people will when they're delivering. Okay. I'm talking like this, that shaky. And they'll shake the entire time. So if she's going like this, like don't think she's seizing like that. A lot of people just shake. Okay. And if you're not prepared for that, that might scare the shit out of you, right? Yeah. So you just kind of try to hold their legs still because they're like, it's involuntary shaking, like they can't stop. So don't be like, ma'am, no, I can't. Okay. Some people puke, some people scream. Like this is a bad time. We're not having a good time during this stage. Okay. All right, vitals Q15. We're looking at literally everything. Now, once the water breaks, you don't do any more vaginal exams, okay? Because there's it's just open, okay? If you have to do one just to like see if she's dilated, you can do it every once in a while, but we're not doing like the Q2 hours anymore, okay? And by the time you get to this point, you kind of know like, yeah, it's time. Okay. Get an emesis basin, cool washcloths, a fan helps, especially since she's real sweaty and it will like get on that sweat, and it'll cool her off. And then we're ready. Are we ready? That was first stage.
So if she like her water broke before she even like is in the latent phase, would you just not do a vaginal exam?
You would have to do them at some point, but you're gonna do them much less frequently.
Yeah.
Like maybe as you start to notice the pattern of the contractions changing and like, okay, mom's starting to get real upset. I think we need to check her. Okay. But you do it like as little as possible. Okay. All right, you want to deliver a baby?
Yeah.
You do? Okay.
Yeah, I think it'd be
So, huh?
cool. I think it'd be cool.
Yeah. So first stage is basically just labor. Second stage, the baby comes out.
Got it.
Okay. So at the end of the first stage, we were ready to deliver. So let's deliver. There's 2 stages inside the second stage, latent and active.
Got it.
Okay. So in the second stage of labor, okay, we are 100%
Effaced.
effaced. We are 10 centimeters dilated. Water's broken at this point. Okay. If not, we went in and did it. Okay. It is time. So what happens is, and everybody does this, they get this short period of time that's like super calm. It's like 10 to 30 minutes where your contractions aren't really doing much. You feel like very tired. And that's when you tell her, turn to your side and take a nap because you're about to go through some things.
That sounds so ominous.
Okay. So we turn off the lights. Just let her take like a little nap to gear up for this big marathon. Okay. Now descend, I don't know, it could be kind of anywhere. Some of them aren't even down yet. Some of them are. So take that with a grain of salt. There is minimal show. Like there's not much discharge coming out anymore. We're not really bearing down. She's very quiet. Right. So our job is just, okay, Q15 vitals. We're going to go ahead and get the stuff ready for delivery, right? We're going to notify the doctor, like when she wakes up, all hell's going to break loose. Okay. So it's time. All right. That's the latent. So everything's like chilled. Then mama wakes up and here we go. We're going to go into active labor. Baby is descending. Contractions are super strong. Every 2 to 5 minutes, they're going to progress to every 1 to 2 minutes. They can last up to 90 seconds. Baby's coming down. We're getting ready to catch it. They're now just bleeding profusely because everything's ripping. Okay. Mom's like, oh my God, I have to push. Have you heard of the ring of fire? Yeah. Okay. So that's where they're trying to get over like the last lip. They'll call it the ring of fire because it burns like all holy hell. Cause it's like stretching, ripping. And it feels like just a complete O of nothing but searing, fiery pain. Okay. So that's what they call the ring of fire. And they're going to scream and say they cannot do it because that's horrifying. They are very tired. They want to give up and they will breath hold you. You have to encourage them to do deep breathing because you don't know when you're in pain, like you tend to hold your breath. So you have to tell them like between contractions to breathe. Okay. So your job during this part is like helping to stretch the perineum, giving them pain relief if they need it, whatever that looks like. Okay. And then remember your 4 P's. How strong are they pushing? Right? Is the passage open? How's their psyche? And what's this baby doing? Okay. There's something else. Oh, offer a mirror. Okay, this is weird. Somebody did this for me, and I said no, thank you. I don't want to see this. She made me though do it when I was pushing, and then I spiked a temp, which I spiked a temp with Kaden too. And so they said, if you do not deliver this baby in 20 minutes, we're going to C-section you. So I was like, bet. Okay. So I was ready and I was pushing. They would count to 10. I'd go to like 15. And I was like, I'm getting this baby. I do not want another C-section. Right. And so I got to the point where I was so tired because I was pushing for so long. And I was like, I just did not want this. I just didn't. So I was like, oh my God, I have to do it though. And so I was like, I don't think I can do it again. I don't think I can do it. She's like, yes, you can. So she's like, do you want to see it? I'm like, absolutely not. And she's like, no, you need to see it. So she got a mirror and I was like, oh, dang, no thanks. And I was like, no, I'm really not interested in that. And then she was like, give me your hand. I was like, absolutely not. And so she grabs my hand so I could like feel the baby was already like
There.
out. Yeah. And I was like, okay, fine. It's already there. So I might as well just get the rest of it out. Okay. So that's when you would use it. Now, some moms want to see, some don't. It is not pretty down there. Y'all know you're like shitting the entire time. Right. And they just scoop it into a bucket. So it's not the most attractive thing to watch. It's kind of fascinating. And then you also get hemorrhoids at the same time, right? Because you're pushing so hard. So they're like, which one's the baby? Because, it's coming out your rectum. Anyway, okay. Where was I? Oh, Ferguson reflex activated. What's the Ferguson reflex? Cool, I'll tell you. So when the baby hits the cervix, and they're going through the cervix, it signals your brain to produce a bunch of hormones, especially oxytocin. So it'll give you that last push of the contractions. Okay. And then we're going to apply fundal pressure. What is fundal pressure?
Like push on top of her belly.
Yes. Remember, we don't push on the top of the belly. We're going to push kind of behind the baby. Right. Okay. All right. Encourage rest between contractions. Okay, that's stupid. You don't have any time. Do not leave the patient alone when they're actively laboring, because that baby can shoot out at any time. And if nobody's there to catch it, it will fall on the floor. Okay, so you've got to have somebody in the room during that time. And then your job is to grab that baby. And then we do APGAR scores, which we'll talk about later. And then if baby needs resuscitation, we do it at that time. Okay, so first stage of labor is literally like labor. Second stage is birth. Yeah. And then third stage is placenta. Okay. So in the third stage, so this is the birth of the baby until that placenta comes out. Short stage, it should be less than 30 minutes when you deliver the placenta. So like after the baby comes out, everybody acts like your job is done. Oh, we starting all over again and delivering this giant ass placenta. So they're going to start having contractions again. Some moms will think that they're having another baby. You can assure them we did not miss twins. Okay. But it does still feel that way. If it's been greater than 30 minutes and the placenta has not been delivered, we call it a retained placenta. Okay. That can cause infection and especially postpartum hemorrhage. Okay. So there are two different ways that you can get the placenta out. You can do it passively, which is the best way, and allow your body to expel it as you release oxytocin. It'll just come out on its own. If it's not coming out on its own and it's retained, then we'll give them some hits. Okay. Clamp and cut the cord in less than 3 minutes. I don't believe in that. Okay. And then apply cord traction. Now you have to be careful with this. You can gently pull to kind of like guide it down. If you yank, it will pull it off the uterine wall and you will cause a massive hemorrhage, or you could cause a uterus involution where the whole uterus comes out with the placenta. Do not tug on the cord. Okay. Yes, you could die from that. Otherwise, they'll just shove it back in and then you'll probably get some surgery. So do not yank on the placenta. Are we clear? Okay. All right. So you can apply what they call cord traction, where you gently, just like a little bit of, I'm not pulling like this. I'm just like pulling till I feel a little resistance and then just holding to see if it'll kind of just like, you see what I mean? Okay. But do not pull. Instruct mom to push when you see signs of separation. The cord will all of a sudden get longer, right? Because it went down in the birth canal, right? It is important to make sure, this is so vital. I cannot tell you. You'll see this in Call the Midwife too. To ensure that the entire placenta is intact. This is true for abortions. This is true for miscarriages. This is true for the placenta. You have to check the entire placenta to make sure it's intact. If any little piece is left behind, you will get a massive infection. You will get septic and you will probably die. Okay. Did anybody watch the show Outlander?
Yeah, I watched the first. Yes.
Only the first season?
I watched it all.
Then I can't tell you. Can you hold your ears really quick?
Well, I kind of forgot what happened.
Well, you won't know what I'm talking about because it wasn't in the first season. So when Claire has the baby, the first baby, and then she gets like, they can't get her better and she gets sicker and sicker and sicker. Yes, because remember her friend came out, Monsieur or whatever, what's his name?
Yes.
Her like apothecary friend. And he like felt over her abdomen and like it was still like really enlarged. Remember, he pushes really hard and then she expels the rest of the placenta and all of a sudden her fever goes away. So it can cause hemorrhaging and cause infection. There it is. I'm in the middle of watching it for like the 5th time, which is why I'm saying this.
I can't get past like once they get to America.
It's not your favorite.
Yeah, something about like I don't know.
I know what it is. It's the stupid ass daughter.
Maybe
I do not like her.
I don't like the daughter.
I don't like her either.
My parents just watched the last season because I still watched it with them, even though like because they always watched it ahead of me, so I just kind of like followed and just kind of whatever. But they watched the last season that came out.
It's fine. It was probably also like hotter when they were younger. It's kind of like just two old people doing it.
Did you watch the last season?
Oh yes, ma'am. I've seen the entire series probably 4 or 5 times.
How like they've made her into like a drug addict, kind of like with the whole.
Dude, I would be a drug addict too if I went through a few.
Yeah, but still, it was like.
Let's see if she
like,
retires.
The whole season was about that. And I was like, nah.
You're right. Yeah, she should have gone through her trauma much quicker.
For the show purposes, they should have.
Anyhow, all right. So, where am I? All right, signs of the 3rd stage. All right, so you're gonna have a firm contracting fundus. You know what the fundus is? Your house.
Or the
lump. Okay. It will go from a discoid shape to a globular shape. So remember, we had to stretch with the baby, and then it'll end up going back down to normal. Sudden gush of dark blood. That means the placenta has separated and it's coming out. So that's fine. Okay, we don't panic about that. Lengthening of the umbilical cord, obviously it's coming down, right? And they'll say, oh, my vagina is full. Yeah, there's a giant placenta in it. Yeah. All right. So assessment during this time, we're doing vitals Q15. This is the time they will hemorrhage. So I need to watch for what?
Your respiration.
Drop in blood pressure plus tachycardia. You will not always see a hemorrhage. I guess I had this idea in school that like a postpartum hemorrhage, like they would just be gushing blood out the vagina. It does not happen that way. Sometimes it does, but not often, right? Because it's not usually from a laceration or what have you. They're bleeding internally, right? The uterus is filling with blood, or the placenta has pulled part of the uterus off, or they've exposed. So you will not always see it this way. But if you do think she's hemorrhaging, you always want to check her butt. Not like that there's, but roll her over. Because when she's laying like this, right, and all the blood pulls in the back. So you may like pull up the sheet and look and be like, I don't see much. There's a little blood, but not that big of a deal. And then you roll her over and then she's just covered in blood all the way up her back. Do you see what I mean?
Yeah.
Okay, because it bleeds kind of backwards.
So is blood pressure and tachycardia?
Yes. And then the fundus will not be firm. You want a firm fundus because that means it's actually contracting. If the if the fundus is boggy, that's where I was going. It's called boggy, where when you push on it, it feels very like mushy. It's filling with blood. Okay. So if you ever palpate a boggy fundus, then you have to do what's called a fundal massage. But basically they just punch you in the fundus. I'm not kidding. You have to go deep from the outside, not the inside, just so you know. You like literally, you're going to put your hand into the fundus like this and you rotate it like that. And they're screaming.
Yeah,
because it makes it contract and it hurts really bad. But otherwise they're going to hemorrhage. So
I'm super new.
oh yeah,
Lila made me do
it's
it.
awful. Yeah. All right. And then we apgar score at this point, which I'll talk about. We talk about in newborns. All right. So nursing care, you're going to help her push it out. They may give oxytocin to help her expel the placenta. Pain relief is good at this point because you can give opioids at this time if you want. If she's not breastfeeding. Perineal hygiene. So they're going to be stitching her up during this phase. Okay. And you are preparing the pads and the mesh underwear and all of that to help her out. Usually within the first 24 hours, you're going to do ice. We're going to talk about all that in postpartum, but you do ice packs in the mesh panties. And then after that, you'll end up doing heat, but we need to like cut down the swelling for the first 24 hours. Provide a space for bonding. Mom has to breastfeed within the first 6 hours if you want to establish a good breastfeeding relationship. So either breastfeed or pump, something has to happen in the first 6 hours. Assist with suturing. If they're suturing her up down there, that's when that's going to happen. And then ask mom what she wants to do with the placenta, because now people do all kinds of things with it.
They eat it.
They eat it, they encapsulate it, whatever. But did y'all know the rules are very strict with placentas? Like the placenta belongs to the hospital, not you. You have to actually file papers to say that you want to take the placenta with you because it's considered biohazardous waste and they're just not going to give that to you, even though it's your freaking placenta.
Wouldn't it be considered like your like organ?
There's a lot of conspiracy theories about what they do with it.
Not the placenta.
Because the placenta is like, I mean, the holy grail of all things, because it's like the most maternal thing and it's full of all this very rich blood and like stem cells and yeah. So I find it very odd that that belongs to the hospital because that's like part of my body.
They want to grow babies.
No, they can't grow babies off your placenta, but they do weird shit with it. All right, perineal hygiene. So you're going to cleanse the area, the vulvar area, with warm water. So they'll give you the squirt bottle if you haven't seen that yet.
Yeah.
Okay. And then you're going to put the pad in, put the ice pack in, change your linens, make sure they have fresh pads, the fresh check pads. And then ask them like, how are you comfortable sitting? Because, you know, you just got a watermelon come on through. Discuss relationship between breastfeeding and contractions. So explain to mom why it's important to breastfeed. You got to ask her though. She doesn't want to do it. That's fine. I still would give at least some education as to why it is important, but don't shame her because obviously it's her personal choice.
While they're contracting.
Huh? No. Discuss the relationship. Oh, I see. No. You want to discuss the relationship with the mother between when you breastfeed, it increases your contractions. And so that can help. Not like, hello.
Right away.
No, this is just let her know that breastfeeding causes contractions because moms will panic. They don't know that, right? So not only is it education for why it's good to breastfeed, but it's also education to let her know because nobody told me that when the baby latches on, you have the worst cramps of your life and then you gush blood. That's scary, right? So you need to let them know that that is perfectly normal and that you'll help them change their pad afterwards. And I'm very glad you clarified that. Yeah. Hey, by the way, are we breastfeeding? I'm here to talk to you about your car's extended warranty. All right, 4th stage of labor. So they've just added this. This is considered the postpartum period. So first couple hours after birth, when the main job should be bonding. Yeah. And this is also another part where they can hemorrhage. Okay. So this is a highly, highly testable what I'm about to tell you. The uterus should be firm at or below the level of the umbilicus after birth. It should be firm and it should be midline. What happens if you go to palpate and the fundus is displaced to the right or to the left? They need to pee. So you're going to tell them that they need to void. Okay. If they are unable to void, like cannot pee at all, then we can stick in a straight cath. Okay. But if it's displaced, it means the bladder is so distended. And this usually happens like after the epidural or those kind of things, right? Then we need to have them pee in whatever way that happens. If you go and you palpate it and the fundus is boggy, then what do?
Blood.
You do a fundal massage. Yeah. To prevent a hemorrhage. Okay. Chills are very common in the 4th stage of labor. Your body just had a massive inflammatory response. White blood cells are still going to be very high at this point. Right. All right. Who's most at risk for postpartum hemorrhage? If they had a precipitous labor, what does that mean? Super fast. Okay. Because that means that mom didn't have time to stretch and she just ripped. Like you have some babies like mom went into labor and the baby's out in 10 minutes and you're like, oh my God, but she didn't have any time to stretch whatsoever and everything got delivered really fast. If you have a big giant ass baby, right, that's going to rip too. Grand multiparity. So you know what multiparity is, but grand multiparity is when they've had over 6 births. Like the Duggar family.
Okay. So it's not like season 1.
No, ma'am.
Okay.
Okay. If they've had a previous MAG infusion, they're more at risk of a postpartum hemorrhage because MAG relaxed everything so the fundus may not contract, right? All right. Assessment in the first couple hours afterwards, you're going to do the BPQ 15 minutes for 1 hour plus their pulse. So BP and pulse, Q15 for an hour. I should have written that better. You only have to take their temp once and it's probably going to be elevated, but okay, whatever. Fundal assessment. So do you know how to assess the fundus? You know, they need to have their knees flexed, head back, and you're going to palpate. Okay. And then push firmly just below the umbilicus because that's where the fundus should be after birth, right?
Yes. Right.
Okay. So we're looking to see if the fundal height is too high or too low, meaning it's not progressing like it normally should. If it's boggy,
Blood.
massage. If it is displaced to the left or to the right, yes. We are going to assess for bladder distension. So you will palpate first. Okay. If the uterus is displaced, like I said, we'll talk about the bladder being full. So ideally, we'd like to assist them to the toilet. Even if they've had an epidural, it's probably starting to wear off by this point. You can take them in a wheelchair to the bathroom and set them on the toilet. We will catheterize only if we have to, because there's already been so much stuff going on down there. It's just gonna be really uncomfortable to have to cath. And then reassess the fundus, and you are checking the fundus all the time. Okay. Assess the lochia, which we'll talk about more in postpartum, but don't know what lochia is. It's the discharge. Right after birth, it's going to be red because you're still going to be bleeding, right? That's called lochia rubra, like a ruby.
Yeah.
Okay. And then you're going to assess Rita. That's postpartum stuff. We will talk about that later, but just keep that in your head for now. And then assess for hemorrhoids because you've been pushing and pushing and pushing, and a lot of them will have hemorrhoids. Y'all know what the hemorrhoid treatment is?
Laxative.
Yes, we'll do stool softeners.
I need to tie them.
Yes, but we won't for her, right?
Like a cream.
Okay, so we'll do a steroid cream that decrease the inflammation, right?
Ice.
Ice.
Stroke.
I've got the problem today too.
Is that when they do the sitz baths?
Yes, it's baths. That's good. All right, so nursing care during 4th stage, vital signs, fundal assessment. We're dealing with pain, making sure that she's peeing. Now, she may not poop yet. The first poop after your baby is horrible because everything has been stretched and broken and torn and oh my God. Perineal pad count. All of this we're going to talk about in postpartum, but this is just kind of an idea. So if they soak more than one pad in an hour, that's a big giant red flag. We'll do perineal hygiene, you know, with the show her how to use the little, right? Sitz baths. If they've had a vaginal birth, they can go straight to regular diet, right? If they've had a C-section, we put them on clear liquids for a while. Can somebody, I'm almost done with this. Hold on. Monitor post-anesthesia complications. You know, oh, I'm going to talk more about that. Hold on. Let me pass this.
Oh, they just.
Oh. Oh, we did?
Yeah.
Okay. Okay. Well, then let me keep going. Okay.
Unless someone sees it.
Okay. So we'll just.
People do that.
You're right. Somebody did that to me in the back. Okay. So we said if they had a vaginal birth, they can go to straight regular diet. If they've had a C-section, we start on clear liquids first because they've had anesthesia and yada yada. Yeah. Okay.
Yeah.
Monitor post-anesthesia complications such as
Paralyzed.
Jesus, I hope not.
Numbness. Urinary retention.
Urinary tension, hypotension, blood loss, right? Like normal post-anesthesia stuff. I mean, I hope it does not. Nausea, vomiting is common after anesthesia, like the normal stuff. You weirdos. All right, maternal infant bonding. This is the time where mommy and baby need to bond by skin to skin contact. Yeah. Remember I said she needs to breastfeed as immediately as possible. But we have up to 6 hours to get her to breastfeed for the first time. And you as a nurse have to advocate for that sometimes, especially if the baby goes to NICU. You either reel mom down to NICU or you get her a pump. Okay.
But it crashed. What were some of the complications? Hypertension, nausea, vomiting.
Huh?
You said hypertension, nausea, vomiting,
Urinary tension, hemorrhage, because they lose a lot of blood in a C-section, right? Let's see. They could dehiss, right? Because they basically staple your incision back up. So that's something you got to watch for.
Fall risk.
Fall risk for sure. Yeah. Okay.